want to know what it's like a day in the life of me, I'm going to caveat something. I don't usually look this good. This is my Instagram look, and definitely I am working hard and grafting all day. So I want to show you guys what it's like to be here for the full day in my shoes and the kind of treatment that we do. First of all, I'm going to introduce you to my lovely Mary. Mary. She is our amazing receptionist. She is the first point of contact with lots of patients. She takes the brunt of the phone calls as well for anyone that can't get hold of us. I know our phone lines are super, super busy, but she is our wonderful receptionist and we love her so much. Sarah's behind me now. She is about to call in a patient and she is my right-hand woman. She's actually my orthodontic therapist, and people get a bit confused. Give us a wave, Sarah. People get a bit confused because they're like, why am I seeing Dr. Sarah now when I initially saw Dr. Rhona? Well, the truth is because Sarah is somebody that I work with all the time. I refer all my patients to her once I've diagnosed their problems and their treatment plans, and she will carry you through treatment with me. So we're going to explain our roles later, but I want you to follow me through the surgery so I can show you a little bit about our rooms. We're going to have a refurb, so don't look at the way the walls look. Actually, when I bought the practice, it was already up and running. It's been up and running for almost 6 years. I came in when I had 0 patients. I bought the practice at the height of the pandemic last year, and I'm planning on completely changing the interior. So don't judge, we will have a crib. What's that program called again? Pimp My Crib, Pimp My Dental Practice. That is what we're going to do. But I'm going to just quickly show you Sarah's rooms. Follow me through here. So this is Sarah in action. She's got a lovely patient in the chair. We can show her feet, but not the rest of her. She's sitting there in secret and she's just doing her thing. So she's usually in this room, or Dr. Richard, who you're not going to meet today. He's basically our dentist that does loads of implants. He treats TMJ patients. So TMJ is your temporomandibular joint. It's basically a fancy way for describing your bones, your muscles, and everything like that. And he deals with all of that. So that's room number 1. We come through this way. And we've got room number 2. This is usually my room, but we've got Dr. Luke in here, and he's a little bit of a princess. Don't tell him that I told you that, but he absolutely insists that he has the best room in the house on a Friday. So even if I'm here, I'm in the smallest room on a Friday, just for Dr. Luke. There he is in action, but just be really quiet and follow me through. So you can see a working man. Come through here. Basically, he's our second cosmetic dentist. I handpicked him because I've known him since I was 20. We lived together. I actually did vocational training. So basically, when you graduate from dentistry, you have to go into a year that we call vocational training if you want to work on the NHS. I met Luke. He was really inspiring, really drove me, instilled so much passion in me, and 10 years later we're working together. He is incredible, has treated loads of cool celebrities as well, and he does work that is just as good or better than mine, and I refer loads of my patients to him if they can't get in with me. So follow me through to this room. Do not judge the mustard colour. I did not choose it. This yellow really stresses me out, but here it is. And I'm not a fan of the orange. I did not choose the orange room. But this is our smallest room, and usually it's where the hygienist is. So for you guys, you might know London hygienist, Anna Middleton. Again, beautiful little story. I'm not gonna bore you with the details, but basically Anna and I started working together because she was my nurse in my very first dental practice. Then she went on to go and study hygiene. Then I got her a job here when I was working here as an associate. And then I employed her obviously full time, and patients love her. She is an absolute superstar in her own right, and she looks after patients. I've got loads of YouTube videos on how we work together, so definitely have a look at those. So that's the surgeries in the room. I'm not going to show you the staff room. I'm going to try and introduce you to the nurses later on. But today when I come in, I usually start at 10 because my morning is all about meditating, exercising, making sure that I'm feeling really, really good. And then I come in and look at my day, and you've just caught me in a break. I've already done a bonding session, which took me 2 hours. And this afternoon, I'm going to be doing a veneer preparation, which I'm super excited about. That usually takes me about 3 or 4 hours, and then I've got another couple of bonding patients, which are about 2 hours each. So my days of long treatments, minimum is 2 hours, can be up to 4 or 5 hours. I will scrub up and look like the Dr. Rhona that you don't see on Instagram, but I have to get in my zone and just do those types of treatments. So I'm really excited to show you, because this is what I live for. These smile designs, changing people's lives, giving them confidence, and you're gonna be behind the scenes for all of that. So stay tuned. Okay, so as promised, you're going to get invited to the secret society of what goes on in this room. I want to introduce you to Carlos as well, who is my ride or die. Just look at his face. Everyone is obsessed with him. He loves working here. He has the best fashion sense. Can we just all take a moment to appreciate his shoes, because they are cleaner and whiter and cooler than my Alexander McQueen's. But he is amazing, and he has everything set up for us today. So really exciting, we are doing veneer preparation. So a lot of the treatment that I do is aesthetic enhancement. With this client in particular, this is his teeth. You probably can't see much if you're not a dentist, you won't really understand, but he had Invisalign to sort his bite out. He had braces before when he was younger, and what we're doing is we're doing veneer preparations. We have what we call a wax up here. So a wax up is what I call a try before you buy smile. It gives you an idea of what your smile is going to look like before you even begin. I showed this to my patient, he was really happy to go ahead. So today what would happen is that we give him local anaesthetic, we put the wax up on his teeth using a stent, we prepare through the teeth, we take records, and then we put the temporary veneers on. In that time he has an ability to assess it, see if he likes it, give me any feedback, and the real ones get fabricated within 2 weeks and we bring him back to fit it. So you're going to see what happens in today's appointments. It's not as gruesome and horrible as you think it may be, and it's fairly painless for the patient. It just takes about 3 hours or so. So have a look there, these little beauties. We can see the teeth are really, really lovely. They are nice, harmonious, symmetrical, they all match each other. But remember, teeth don't come out of the patient's head. We always plan a smile according to your face and whether it suits you. It's what we call facially aesthetically driven treatments, and we basically know that a smile on one person may not suit another person. So this is a special bespoke smile designed especially for this patient. So we're going to bring him in really soon and you can see what happens. So this is called single tooth anesthesia. The machine is absolutely amazing. Alright? So it's meant to be much less painful than normal anaesthetic. So we're going to just use this opera gate here. Pop it into the mouth. Carlos, could you pass me the stent with the Luxatent, please? Cool. So I use something called the Gallet-Garel technique, which means that we do minimal preparation of the teeth. My favourite material is Luxatent, which I use. So I'm going to load it in here and then put it on top of the patient's teeth. And what it means is that we don't take away too much unnecessary tooth structure, just only what is necessary to ensure that we are getting veneers that look aesthetically pleasing and give the desired aesthetic outcome. So Carlos is just loading that for me. Perfect. Okay. And then it goes into the mouth. So we leave it in there for just a few minutes. So this is how the veneers are going to look, so it gives you an idea. I've done my whole preparation. It's taken me about 2.5 hours. And I've put some retraction cord into the gums. So the retraction cord basically pushes the tissues out of the way, make sure that we get a nice clean impression. So that's the next bit that I'm gonna do. So I do the 2-stage technique where we use the heavy body and then we use a light body to get more detail of the impression. And I also take a scan because I'm like super particular, so I kind of do double assurance for the lab. So I absolutely love getting these impressions. You can see if you look really closely that the material has got into what we call the sulcus, which is basically the bit underneath the gums. So this ensures that the technician can create perfect margins for the veneers. So I'm super particular about it, but I'm really, really happy with that. We've got all the detail we need. But as double assurance, I'm gonna take a scan and we're gonna finish up there for the video, but you're gonna have to come in or tune in to see how the fit goes. So I take all of these records of the patient, just making sure I get all the facial structures right, the planes, whether the teeth are going to be parallel, horizontal, all that kind of thing. And as I'd mentioned, we'd already taken our scan of the teeth as well on top of the impressions. So after this, I am going to put the temporaries on, and that's a super cool, exciting bit for the patient, and they get to see how their smile is and live with it. So I hope you guys have enjoyed. I'm going to be here for like another hour or so, and it's a long session, but every client has to have this amount of time to get the right results. So see you guys later.